Good afternoon. This is Sarah Chris with Connect Our Elders, and I'm here with David, Chong, and Dika from Coast Care Partners. First of all, congratulations, Dika, on your new position at Coast Care Partners. I can speak firsthand. A wonderful company to work for. Before we get started with learning about the county's Respite Well program, I did want to take a couple of minutes just to express my gratitude to David Chong and Coast Care Partners for the fact, many of you may not know this story, but I went to work for Coast Care Partners, and he actually hired me about 5 months before I was getting ready to deploy. And he knew I was getting ready to deploy with the Guard and hired me anyway, and we maintained a working relationship. And even now that I've begun Coast Care Partners, we're still closely aligned. I could not recommend Coast Care Partners more highly. So now that that's out there, David, why don't you go ahead and fill us in on the Respite Well program that you are partnered with the county on.
Yeah, sure. Thanks, Sarah. And it's been a pleasure to work with you going back to 2010, 2009 or something. So Sarah and I have been collaborating in the community for a very long time. And you're always kind of when I talk about the ideal salesperson, you're often kind of our prototype for that. So
thank you, David.
Thank you, Sarah. Hey, and okay, great. So Respite Well program. So the county's done a lot of kind of different programs for seniors out of aging and independent services. Some of them there's kind of a patchwork of different programs. And about 2 years ago, Supervisor Jacob had this idea of a respite voucher for people with Alzheimer's disease and related dementias. And her vision, and she's been a huge supporter of Alzheimer's issues here in town, as probably a lot of people who watch this know. She's been a huge supporter of that through the years. And this idea that she had, which as far as we can tell is novel throughout the country, was kind of a share of cost program. So it was meant to be where consumers kind of have some skin in the game, as her office would call it, some skin in the game where consumer dollars are matched dollar for dollar with county dollars to provide a temporary respite care for folks with Alzheimer's disease-related dementia. And that care can be either in the form of in-home care, part of what we do, or it can be in assisted living, or it can be part of an adult day program. And so we help coordinate all of that.
That's wonderful. I think it's important to point out, too, with this Respite Well program, you're still getting the same service through Coast Care Partners that you would be getting if you were paying the full price. It's just, if you qualify for the Respite Well program, the county is subsidizing half of the cost. So still super high quality care, just much more affordable for your specific situation when you're needing some respite. What is the qualification process?
Yeah, so let's see. So the request for proposal was very specific about a year and a half ago. So this program just launched in 2019, February or March. This is the second full year of the program. Qualifications, when they first rolled out the program, the idea was that it would be not income qualified, right? So the vision was that regardless of income level, anyone in the county could participate in it. So there's really only two requirements. One is that somebody has some level of cognitive impairment, and there's various ways that we can establish that. And then the second piece is that there's a primary caregiver involved that has some level of stress. And I think Sarah, I don't know if Sarah was with us as I think you were. We were planning we had internal discussions several times of when we test somebody for stress, what level do they need to reach to qualify for the program? And, after a couple of conversations, well, gosh, if you got somebody with Alzheimer's in your life, you got some level of stress that needs some reduction. So really it's kind of just everybody kind of passes that stress test.
They do. And, when I would be meeting with the families and having them, do the stress test, what is it? The Kingston's caregiver stress.
It is. Yes.
So it's really important to let the family caregiver, the spouse or the daughter or son, right, let them know, you be honest about the stress, because so often family members want to kind of mask how stressed out they are, but it's very important to be able to admit the level of stress you're feeling, so that way, people like Coast Care Partners with Respite Well or other resources can effectively help you. So let's talk about this. Even if there's not an official diagnosis of dementia, what can be done? I mean, the point in asking this question is that I want to encourage people to at least see if they qualify for the program,
Yeah.
even if they don't have an official diagnosis.
Yeah, that one's a little more. I'll roll on with that one too, because there's some variety there. When the program first rolled out from the county, it was a program for Alzheimer's disease and related dementias. So our team thought we knew what that meant. So we scrambled all around and looked at DSM and Alzheimer's Association. Turns out we couldn't find an agreed upon kind of technical definition of ADRD. But the definitions we saw were always very broad. Alzheimer's and Parkinson's related dementia and alcohol-induced dementia, and so there's all kinds of different types of dementia. So when we approached the county with our program, we said, hey, look, we're going to run a mini mental exam, the MMSE2 brief version, and based on how they present cognitively, we'll let them qualify for the program that way. So it means kind of regardless of diagnosis, and a lot of people know the Alzheimer's diagnosis is tough. That's only post-mortem and whatnot. So regardless of what the actual diagnosis is, so long as there is some cognitive impairment, you can qualify for the program. And that's why we've seen, again, the vast majority of our folks do have some diagnosed form of ADRD from a neurologist or primary care physician. But we've also had a lot of folks on hospice have benefited from this program. And with end of life care, the cognition can be compromised there at end of life. So we've had a lot of folks even on hospice participate, and even when they don't have a formal diagnosis.
Okay. Would you guys like to get into the specifics of the program, the three different levels of care, or would it be best for individuals to reach out directly to Coast Care Partners or go to the website?
Always the most accurate thing is go to the website. So the website is respitewellsd.com, respitewellsd.com. And some of the basics of the program are kind of set in our contract with the county. So in other words, like pricing is set, and it goes up every January 1st with minimum wage. When minimum wage goes up, it goes up the exact same percentage. And so this year for 2020, for home care, the rates are like $14.62 per hour. Adult day programs, $58 per day, and assisted living is $133 per day. Those are the half price consumer contributions for those costs. But from time to time, the program changes in terms of, we did like silver, gold, and platinum programs, and we rolled out a crisis program early last year, and actually we had so much demand back in October that we had to start a wait list for the program that lasted for a couple months. There's no wait list now. So from time to time, the kind of availability benefits can change. The rates will stay pretty stable. Will stay stable for the whole year. But and then maybe one other thing, it was a pilot program from the county. So they were like, hey, let's try this thing for a few years, see how it goes. And so they've been really great to work with in terms of, hey, we should tweak the program this way or tweak it that way. And they're like, well, you guys are, what you're doing, so run with it. And it's been good about meeting market demand that way. So
it has. What would you say? What has the impact been in the community? I mean, I've personally dealt with families. You have, David, Dika, obviously you've dealt with families. So, what has been the impact of the Respite Well program in the San Diego community on the front lines, meeting the relief for the caregivers and,
Dika, you've probably seen a couple patients recently, haven't you?
Yeah, I'd like to speak to that. I mean, the most amazing part about that is, usually at the point that one of these families decides to get a caregiver, there's been an incident, right? So they've gone to the hospital or something. So when they're getting this referral, which our greatest referrals are coming from the hospitals and home health and hospice, it is such a relief to them that this portion of the care is so accessible to them, and that we're right there ready to help them with this amazing program that's going to get them care in place immediately. And it's just such a part of the relief for them. So it's amazing how it benefits the families, and just as part of that package of just making sure that their loved one is really well taken care of.
It is, as David mentioned earlier in the call, I've been with David since 2012. He hired me into the elder care industry. We were even competitors for several years, but still, very friendly competitors, right? Because I have this saying, that when it comes to caring for our elders, it's about fidelity to the cause, not the job. And so I really enjoy working with people who have that same sentiment. And I really feel like this partnership, right, between Coast Care and the county and being able to provide this respite fits in line with that. And if there's anything that I could request more for this program would be for the county to consider more funding, because those of us that are actually meeting with the families on a daily basis, we know that the need far exceeds even $1 million. So, obviously I'm not involved in politics or anything, but I guess I just urge people to understand that, the magnitude of the issue for family caregivers and caring for their loved ones is huge. And so any increase in resources that we can offer together is wonderful. It benefits everybody in the community. Is there anything else that you'd like to say regarding the Respite Well program?
Yeah, I would just add, if anybody out there knows of a family who, has anybody with mild, with cognitive impairment or dementia, has any questions or even thinks that they may or may not, be eligible for this, to reach out and give us a call, and we will walk you through the parameters of the program. We'd be more than happy to help you. Wonderful.
How can you guys be reached? What's the telephone number?
We can be reached. Go ahead.
Okay. Our number is 619-354-2544. Our website is coastcarepartners.com. We have our staff, our scheduling staff has their phones with them 24/7. So when you call, you won't be sent to a call center in the Philippines or something. We're happy to serve you when you call.
That's wonderful. Well, thank you, you guys. Sarah, Chris, David, Chong, and Dika from Coast Care Partners. Connect Our Elders is all about connecting our elders in the community to all of the resources that exist for them, and then providing education and navigation to help them figure out what the correct resources are for their particular situation. I really thank you guys from Coast Care Partners for being on today. If you have any more questions about Respite Well or caregiving or care management services, please reach out to Coast Care Partners or myself, and we're all happy to assist you. Thank you and have a great day.
Thank you, Sarah.
Thank you.
Bye, guys.
Bye.